effective and cost-effective. B is holistic in perspective and open to new models of care, delivery, and discovery. C is patient-centered and emphasizes the importance of self-care, wellness promotion, and disease prevention. D empowers the patient with information and choice. E creates financial incentives for innovation. And F promotes a culture of innovation throughout the healthcare system. A debate. The Honourable Member for Nanaimo, Alberni.
Thank you very much, Mr. Speaker. Well, it's a great pleasure to rise today to introduce and discuss for the first hour debate Motion 501. It's a national strategy, as Mr. Speaker has so capably read to the House, for innovation, for effectiveness, for cost effectiveness, for sustainable healthcare. Mr. Speaker, accelerating healthcare costs threaten not only the sustainability of our healthcare system, but they imperil the future competitiveness of the Canadian economy. If we want to develop a high-impact, sustainable healthcare system that leads the world, it's imperative that we consider every avenue of promising intervention. There are clinical efficiencies, Mr. Speaker, that exist but are underutilized, or they face institutional barriers in implementation. We have the capacity to overcome these challenges and release billions of dollars into our economy while improving clinical outcomes, patient and clinician satisfaction. Recognizing the constitutional divisions and powers that make addressing healthcare innovation a vexing challenge, Motion 501 calls for collaboration with provincial territorial partners, and it's crafted to empower the outside-the-box clinicians in the medical world. Mr. Speaker, just 3 weeks ago I was in Toronto with about 200 doctors from around the world who gathered to look at what else works. It's the International Society for Orthomolecular Medicine. And these are people, they're in every province, they're from across the country, from across the U.S., from around the world, looking at how can we get better clinical outcomes by using means and approaches that are less toxic to the body and get better clinical outcomes. Their approach is collaborative, it's interdisciplinary, it's driven by a passion for superior clinical outcomes, for patient empowerment, for self-care and choice care. Self-care is the foundation of healthcare. We have across Canada, Mr. Speaker, many such clinicians. They're self-described as functional medicine or integrative medicine or orthomolecular physicians. And what does orthomolecular mean? Well, Mr. Speaker, orthomolecular was a term coined by Linus Pauling, the only man to get 2 Nobel Prizes in the history of the world, one in science and the other one in a Peace Prize. But it just means using molecules in their natural state. And as opposed to patented medicines where they take a molecule, but in order to control the molecule for its role in the body, they have to change it somehow. I often describe it as like having somebody analyze a football team and deciding that it's the quarterback that makes that team hum. But you can't use the quarterback in his natural state, so you have to take his head off, tuck it under his arm, and then send him out to play without the rest of the team. Because actually in nature, a lot of these molecules work in synergy with other compounds that are found in natural sources. So they like to use natural molecules. They're using the foundational tools, thorough case history, physical, laboratory, and technical diagnostic aids, but they prefer applied biochemical approach using natural molecules rather than patented medicines. Patented medicines are actually, because they've been modified, they've been hydrogenated or carboxylated or methylated to make them patentable. They're very much like the natural molecule, but they're not as good a fit. They're therefore xenobiotic or foreign to biological processes, and many of them end up blocking other metabolic pathways in the body and therefore leading to side effects that are unhelpful. Natural molecules are common in biological systems. They're generally well tolerated, low risk, and when they're applied intelligently, they're highly effective for a wide range of clinical presentations. So the strategy calls for both setting up in collaboration with provinces and territories, setting up centers where you can look at what else works. And I want to give examples of how this is already being done across the country and how it can release funds and get better clinical outcomes for Canadians. The focus needs to be on both effectiveness and cost effectiveness, because you can have a treatment that's effective but it's so expensive it's very difficult for the public purse to pay for those treatments, and that creates strain on the system. It needs to be collaborative and interdisciplinary, because we don't know everything, apparently, about the body. It's like saying we know everything about the universe. Apparently, we're still learning, Mr. Speaker. And it teams up integrated medicine with allied professions, like naturopaths, like chiropractors for mechanical, spinal, and joint dysfunction. And it fosters competition for better healthcare outcomes that are both effective and cost-effective. You could have regional centers that are taking a small amount of federal investment along with a provincial investment to look at what else works, and then reward the ones that are getting demonstrated outcomes. And I'm going to give you examples in a moment of some of what they look like. And we need to empower the patient with both information and choice, because sometimes a great treatment is offered, but there are institutional barriers to that being implemented because the patients are either not offered choice, or there are people standing in the way that do not want to see competitive therapies advanced. Now, I'll give you an example here. In May 2014, the School of Public Policy, the University of Calgary, sponsored a vitamin D forum in Ottawa. They brought many lead experts right over here to the Chateau Laurier, Dr. Heaney from Nebraska, Dr. Hollick from Boston, Dr. Veith from Toronto, and others. There were a few MPs from the Health Committee that attended, and their purpose was to meet with Health Canada officials about cost savings and the benefits of increasing blood levels of vitamin D3 for Canadians. Canadians aren't getting enough vitamin D, Mr. Speaker. What's with that? It's the sunshine vitamin, but for 8 months of the year, the sun's too low in the sky, the atmosphere filters out the UV light that's necessary for your skin to produce vitamin D, and then for most of the time, our skin is covered. And in the wintertime, if it's your face might be exposed a little bit in your hands, but you've got 80 to 100 trillion cells in your body. They all have receptors for vitamin D, and your face cannot produce enough for your whole body. The experts say we need to get our blood levels up to about 100 to 150 nanomoles per liter for optimal health effects. Beyond bone health, it's about reducing cancer risk. It's about reducing heart disease, about reducing diabetes. It's about getting better mental health outcomes. It's about reducing preterm births that cost the system an immense amount of money and put the babies born prematurely at risk. So a whole range, almost any disease you want to name is easier to manage if your vitamin D levels are up. Published literature indicates that we could save $14 billion a year just in breast and colorectal cancer alone. That's in the medical literature from the results of 2 major studies, and reductions in heart disease, diabetes, improvements in mental health, and I mentioned some of those things. The cost benefits are immense. Why wouldn't Canada move quickly to implement these kinds of cost savings? There's recently published research here by Dr. Paul Voiglers and John Ekwara. They re-examined the raw data that the Institute of Medicine in the U.S. used to determine what vitamin D3 amounts Health Canada adopted. There's a huge statistical error was found in the analysis there, because these researchers have been wondering, how is it possible that the levels they're recommending are low? So were they off by 10%? Were they off by 20% or 50% maybe? No, or not even 100%, Mr. Speaker. They were off, according to the recent statistical reanalysis, by a factor of 10, meaning the recommended levels are only about 1/10 of what people need for optimal health care, and that could result in immense savings. In Vancouver, Dr. Hal Gunn and his team at Inspire Health, they have been getting superior results with cancer patients, although the oncologists are treating the patients the same as other patients. But their approach, they take the fear out of cancer treatment. They give nutritional instruction and advice to the patients. They emphasize the importance of exercise. They optimize the vitamin D levels. Everything works better when your D levels are up. And they do things like yoga. They do stress management. They explain what's going on in their bodies. And they empower the patient with information and choice. And Mr. Speaker, BC, the province of BC has taken notice. The BC Cancer Agency has taken note. BC Cancer Agency has taken note. And the province has expanded opportunity. But there are still barriers to optimizing and accelerating the potential in this approach. There are new cancer drugs on the horizon that are about helping tumor cells trigger impaired immunodefense or programmed cell death or apoptosis. These new treatments are on the horizon. They spent nearly a decade trying to find ways. Programmed cell death is an amazing internal controlled demolition that cells go through. They estimate 1 million cells a second are going through programmed cell death if they've been hijacked by a virus, if they are broken down components, or they're not functioning properly, or they're unnecessary for what's going on in that particular tissue. without damaging neighboring cells. But these new treatments are entry-level $10,000 a month. That'll be $120,000 to $140,000 a year. The public system is going to come under enormous pressure to provide cutting-edge treatment. You see, Mr. Speaker, cancer cells have lost the ability to go through this programmed cell death, which means something has programmed the cell to interrupt that cycle, or has changed the program, shall we say. So, but I can point you to literature from the Proceedings of the National Academy of Sciences, a prestigious journal in the United States going back to 2005, where they talk about an intravenous treatment that will do exactly that, will reinitiate apoptosis or programmed cell death by simply using intravenous vitamin C. There are naturopaths, there are integrative med docs across the country in some jurisdictions doing these treatments. And I know the Integrative Cancer Clinic here in Ottawa is looking at new models. It's a great program they're working on there. But there are barriers to these treatments being applied, and they're far more cost effective than what will be introduced. We need to look at everything that shows promise and remove barriers to looking at more cost effective treatments. This treatment could be offered in any remote community. It's a simple intravenous. Ascorbic acid is the agent that's administered. Linus Pauling was saying it more than 40 years ago. It actually introduces cell death, and we know the mechanism of cell death. It happens through production of hydrogen peroxide in the interstitial area of the tumors, and the cells proceed with programmed cell death. Unfortunately, some people have tried to apply this, but there have been barriers. For example, oncologists not approving the treatments unless they've exhausted chemotherapy and radiation. So providing patients with choice is about giving them informed consent and allowing them to try a small c conservative treatment when their immune system has not been damaged by the unfortunate side effects of conventional treatment, and the outcomes might be far superior. Mr. Speaker, C. difficile infections claim thousands of lives annually in the U.S. and Canadian hospitals. The rise of these infections is linked to gastric acid suppressing drugs and antibiotics. Now, Health Canada recently approved a preventative natural health product, called BioK Plus, that rebuilds the microbiome devastated by antibiotics. So if you have a lung infection and they want to give you antibiotics, it's a nasty side effect that we kill all the healthy bacteria here in your colon and set the stage for a C. difficile infection that kills somewhere around 1,400 Canadians a year. And in the United States, the new figures look like double that, so it may well be higher in Canada as well. But it may lead to an unnecessary bowel surgery. So there's a hospital in Montreal area has been doing this for 9 years by simply giving a potent probiotic, 50 billion CFUs times 2, twice a day, and have nearly eliminated all C. difficile infections and a high reduction in other antibiotic-associated diarrheas that cause extended hospital stays, hundreds of millions of dollars in extended health costs, and put Canadians at risk. So, Mr. Speaker, after 25 years experimenting with acid-suppressing drugs, there's a 40 to 275% increase in risk of C. difficile. You know, I've been raising that issue for more than 10 years with Health Canada officials. I had press releases about this after the Drug Safety and Effectiveness Network reviewed the issue with the support of the Health Minister and the Prime Minister's office. They took it on as one of their first projects and came back reporting basically on what I've been saying for 10 years. It's a dose-response fashion. It's 40 to 275% increased risk, and it is a class effect. I'm pleased to see that the CMA Journal did write it up about a year ago, and the Canadian Association of Gastroenterologists, under the Choosing Wisely Canada program of the CMA, have recommended limiting the use and the shortest possible use of these antibiotics. Now, Mr. Speaker, in Alberta, we have a program called Pure North Synergy. This program saves about they put about $200 million into healthcare in Alberta. It's an innovative program that takes people and they have a lot of homeless people, of high needs people, First Nations people, Inuit people, and other citizens as well. And they have given them the vitamins and minerals they need through their program. They have about 100 doctors, nurses, naturopaths working on their program, and their outcomes, they estimate, have saved an immense amount of money for the Alberta healthcare system. Here is an article by the School of Public Policy, the University of Calgary, just published in January of this year, Bending the Medicare Cost Curve in 12 Months or Less, how preventative health care can yield significant near-term savings for acute care in Alberta. And they talk about this study with Pure North Synergies Foundation Preventative Health Care Program. They find the sort of preventative health care services offered by Pure North can lead to genuine and significant near-term cost savings for Canada's single-payer health system. Participants in the first year of the program required 25% fewer hospital visits, 17% fewer emergency room visits compared to the control group, and when those persisted for a full year, they had 45% fewer hospital visits in the year after joining and 28% fewer emergency visits to the emergency rooms compared to the control group. That's an immense cost saving that's saving the healthcare system an immense amount of money. The cost is about $500 per participant, and they estimate they save about $1,700 per person in Alberta. And if everybody was implemented a program like this, it would obviate the need for 2 hospitals the size of Calgary's Foothill hospitals and release about 1,600 beds to be used for other purposes, Mr. Speaker. That's what Motion 501 is about. It's about empowering people that are looking for better answers, and I hope all members will support the bill. Thank you.
Questions and comments? Questions et commentaires. The honourable member for Edmonton Centre.
Well, thank you very much, Mr. Speaker, and I thank my colleague for a very educational speech. And I know his passion for the subject, and I certainly applaud him for that. But I would like to learn a little bit more from him on maybe what some others are doing, perhaps in the United States or elsewhere, and ask him a little bit about the holistic approach to healthcare, i.e., treating the patient versus treating the disease.
The honourable member for Nanaimo, Alberni.
Thank you very much. I thank the member for that question because the time goes so quickly. I wanted to mention what they're doing with our veterans south of the border. They have a huge problem, and they have a program led by Tracy Gaudette for the transformation of healthcare as applied to the veterans down there. And she mentions the increase in the past decade in heart disease, diabetes, and stroke in spite of the best efforts. And the message is doing more of the same, even if we do it better, is not going to fix the problem, not for the veterans, not for our healthcare system. And they are using an integrative approach. The way they define that, Mr. Speaker, is this way. It's whole health. It's a well-developed national infrastructure for provision of a proactive, integrative health approach for veterans, which is inclusive of a relationship-based approach, self-care strategy, complementary and alternative approaches, and integrative healing health coaching. And this approach puts the patient at the center of the treatment. They are concerned that the healthcare costs are not sustainable. The Institute of Medicine Summit on Integrative Medicine and the Health of the Public in February 2009 said this: the disease-driven approach to care has resulted in spiraling costs as well as a fragmented health system that's reactive and episodic as well as inefficient and impersonal. And that's what this motion is about, trying to move the yardstick so we get better outcomes for our vets, for the elderly, for First Nations, for Inuit, and for all Canadians. Mr. Speaker.
Questions et commentaires. L'honorable député de Beat.
The honourable member for Abitibi-Temiskaming. Thank you, Mr. Speaker. I'd like to know why my colleague in the motion didn't choose to talk about the importance of innovation and being more efficient in order to preserve the public healthcare system in Canada. Is the reason that he thinks that innovation should go hand in hand with preserving our healthcare system? The honourable member.
A very good question. Of course, the programs I was describing in Alberta with Pure North Synergy was innovative. With Inspire Health, it is innovative. With the University of Calgary School of Public Policy, raising the D levels for Canadians, it's a simple, low-cost intervention that would save money. Also out of Alberta, an innovative project called Empower Plus that helped many Canadians with mental health disorders like bipolar disease and other psychoses. A simple vitamin, mineral, and amino acid compound. You know, they had a struggle with Health Canada, but that program has continued because of help from members of this House. And now there are at least 22 peer-reviewed articles in published medical literature about better clinical outcomes using vitamins, minerals, micronutrients, if you will, to help people overcome psychiatric disorders and bipolar and get off medications and actually lead more normal lives. I could go on innovation. I can tell you in England, in the National Health Services over there, the Northwest Division has got a whole program. They are mandated to innovate, and they've got a whole cycle of health innovation, education clusters, evidence, a new legal duty to innovate. They have challenge prizes. They have like a Dragon's Den where people can bring forth ideas, and a Commission for Quality and Innovation. They have a Healthcare Innovation Expo, innovation funds, academic health science centers, and all of this together can release tremendous clinical outcome improvements and better cost savings for the system and healthier Canadians.
Resuming debate, I please debate the honourable member for Edmonton Centre.
Well, thank you very much, Mr. Speaker, and for allowing me to speak on the important issue of innovation in healthcare. I'm pleased to join today's debate on this motion M501 put forth by the honourable member for Nanaimo, Alberni. I'd also like to start by acknowledging my colleague's long history in this place and his passion for this particular topic. I know it well, and as I said earlier, I applaud him for that. We all know that representing our constituents is a true privilege. I know that he has worked hard to live